Assalamu alaikum. The effect of reciprocating instrument and root canal filling techniques on post-operative pain in retreatment. This article was published in the European Endodontic Journal in 2023 by Novruzova and colleague. The aim of this prospective clinical study was to compare the post-operative pain after single-visit non-surgical root canal retreatment using two different instruments, the reciproc files or hand files, and different filling techniques, continuous wave or cold lateral compaction. This study was performed on 45 patients in the age range of 18 to 65 years old who referred to the Department of Endodontics with diagnosis of failed root canal treatment. And the patients were randomly divided into three groups, 15 patients each, according to the instruments used for retreatment and the filling methods. Retreatments were performed in a single visit by a single endodontic specialist using one of the following techniques: hand file with lateral compaction, reciproc with lateral compaction, and reciproc with continuous wave compaction technique. In group 1, where teeth were obturated with lateral compaction technique after removal of canal filling with Histron files with no solvent used in any of the groups. The canals were then irrigated and dried with paper point and filled with lateral compaction technique using H+ root canal sealer and gutta percha. After root canal filling, a cotton pellet was placed in the pulp chamber and the access cavity was closed with a temporary filling to avoid coronal leakage, and the patient was referred to the restorative department. In group 2, where teeth were obturated with lateral compaction technique after removal of canal filling with reciproc files, and the canals were prepared using R40 for premolars, R25 for mesial canals, and R40 for distal canals in molars, and the wider canals were prepared using R50. The sequence of the final irrigation and lateral compaction procedure was carried out in the same way as in the first group. In group 3, where teeth were obturated using continuous wave root canal filling technique after removal of canal filling with reciproc files, and the whole procedure was done as in group 2, and the irrigation protocol was also similar to the previous two groups. Finally, the root canals were filled with gutta percha cones and H+ sealer using continuous wave compaction technique. And after that, all patients received a questionnaire to rate the intensity of pain at 24, 48, 72 hours, and 7 days after the retreatment was complete. The patients filled the verbal rating scale ranging from 0 to 3, representing the intensity of pain. Coming to the results, regarding post-operative pain, there was no statistically significant difference between the hand file and reciproc groups, which were obturated by lateral compaction technique, and no significant difference was found between lateral compaction and continuous wave techniques in teeth instrumented by reciproc instrument at any time of the 4 intervals assessed. When we assess the pain level, the highest post-operative score was found 24 hours after treatment, and it declined over time. In each group, pain decreased from 24 hours to 48 hours and 72 hours, but statistically only difference was found in reciproc groups in all intervals, and no pain was recorded 7 days after treatment in any groups. So when total pain incidence was calculated, 60% of the patient had discomfort or pain after 24 hours after the retreatment, and the incidence was decreased in time, 24.4% in 48 hours and 17.8% at 72 hours. And statistically difference was found between all the intervals. Since no statistically significant difference has been seen between groups regarding post-operative pain, it seems that instrumentation or root canal filling technique had no effect on post-operative pain in retreated teeth. However, post-operative pain incidence was found to be high, 46.7% in hand file groups and 66.7% in reciproc groups, and totally 60% of patients had discomfort or pain in 24 hours. And as we said, the intensity of post-operative pain was decreased gradually over the study period in all groups, and at the end of the 7 days period, no pain was declared.